Edward-Elmhurst Health presents this Healthy Driven Minute.
Everyone knows someone who has had breast cancer. We estimate it's about 1 in 8 of women will develop hopefully a lower stage, but some stage of breast cancer in their lives. Someone with a family history, so generally that means a first-degree relative has had breast cancer or multiple more distant relatives. We see some association of breast cancer with higher weight, some increased risk for all types of cancers with smoking, increased estrogen exposure throughout our lives. So women who start their menstrual cycles at a younger age, women who have never been pregnant, women who have never breastfed. The screening for breast cancer has 2 different modalities to it. One being a clinical breast exam, which either a primary care provider or an OBGYN can provide that clinical breast exam, which we recommend every year from the age that you start seeing a doctor regularly. The further screening, called a mammogram, which is like an X-ray of the breast tissue, is generally started at 40 years old because we want the opportunity to catch a breast cancer in an early stage. Most often, the first symptom is a mass or a lump found within the breast tissue, but the large majority of these masses or lumps that are felt end up not being cancer. So it is the earliest sign, and we can't tell just by feeling whether that mass is breast cancer or not, but that should lead to that person coming into their physician for an exam and probably further imaging. A biopsy is often the next step. If the results from that biopsy show cancer, then the patient is automatically in with the breast surgeon, the oncologist, so that they can formulate a plan and determine whatever their treatment may be. It completely depends on the stage of the breast cancer and the type of breast cancer, because there are many different types. And so for some patients that will mean surgery, for some that might mean radiation or chemotherapy.
For more information, visit eehealth.org.